Welcome to PrognoCIS. Today we're going to do a quick video of the EMR database. When you first log into PrognoCIS, the first screen that you see is this home screen. If you look up in the upper left corner, you have arrows. The arrows will take you forward and backward a screen as you start moving through the system. The house will always bring you back to home. Each one of these tabs across the top are menu tabs. They'll take you to other screens and places in the system. Over here in the upper right corner, we see a bunch of icons. The first icon is a flashing new icon. This icon will show you all the new releases and explain how they work. This next icon is a dashboard, so you can see all your favorite reports at a glance, 9 at a time. You can have up to 10 different dashboards between EMR and billing, and you can use the gear to determine which reports are going to be in which cell on the dashboard. Over here on the left, we have a filter, so you'll be able to filter out by date range, provider, or location. Over here, we have an ARA dashboard, which lets you see how you're doing with meaningful use. You also have your population health dashboard, a switch to billing, quick appointment scheduling, search for a patient, go to an encounter. You have your inbox messages. You have your resource center, which will give you videos, documentation, quick user guides, frequently asked questions, and also allows you to contact tech support, enter a case, call them, chat with them. Right here we have a help button, which is A through Z, different topics in the system. And then we have our I button, which is information about your system, and then your lock and log out. So back to the home screen, we have two buttons across the top. This is appointments, so it'll show your current appointments for today. And then your open encounter. So any encounters that you may not have closed yet, that weren't finished, you're going to find them under your open encounter tab. Now for your home screen, you have a filter where you can filter out by location, by provider. So you can not show everything on your home screen. You can just see the things that you'd like to see. And also you have the manage column button, which controls the columns that you see across here. So each individual user can set their columns according to what they need to see for their position. You have scheduled, you have your date, time. You can go forward a day or backward a day. You click in the middle here. You can pick any day on the calendar. The T will always bring you back to home. If you only want to see telemed visits, just click this button and you'll see only the telemedicine visits. Right here we have our schedule for the day and the actual time the patients arrived. Here are patient forms. As the patients complete their patient forms, they'll turn green to let you know that they have completed them. And once you save and accept them, they'll turn red. If they did not complete a patient form, it'll be yellow. Over here, we have some icon tray where I click on it. I see a tray of icons, which also will take me to other places in the system. Now, if I click on the patient's name, it's going to take me to the patient encounter. There we go. And it lands me on the face sheet. At the top, we have what's called the patient band, which has vital information up at the top. You can customize the patient band if you want. And right here, we have the face sheet, which is past history information. Right now, you're seeing 9 different cells. You can have up to 16 different cells. You can move these cells wherever you want them, so you can have them in the order that you'd like. You can also enlarge them or make them bigger. Or smaller, depending on what you prefer in your office. You can have up to 9 different face sheets. So you can have multiple different types of face sheets, different styles and different things like that. So you can completely customize your face sheet. Over here to the right of the face sheet, you'll see that we have a progress note and a face sheet. So I can see my face sheet from other screens by clicking on that little 3-dot button. I can also see the current progress note as I'm writing it. So as I'm writing my note, I can actually click on there and see what's on that, going to be on that note. If I was doing a telemed visit, I would have another little option down here for I can pull up that telemed visit and see the patient and still document in my chart. Right here I have vitals. This is an alert to let me know something about my vitals, but I have different styles of vitals that I can take. I can take a brief vital, a detailed vital. The BMI will automatically calculate. If I wanted to, I could copy my vitals from a previous visit. This patient doesn't have one, and it would populate here. If I had copied it from previous visit, the background would be yellow and anything I had changed would be gray. If you notice that at the bottom, I have directional arrows, which will take me from one screen to the next. So if I click on the HPI, it saves my screen and then moves me to the next. So the patient is coming in because of an ankle injury. So the ankle injury template automatically defaulted, but you can come up here and you can choose any type of HPI complaint that you might have for your specialty. So as you can see, I have 11 different pages of HPI complaints. I can go ahead and just simply type in the complaint and just narrow it down that way. Select it, and then it would come over here. I can choose to document by completing my templates. I can type my answers down here, or I can even dictate my answers down here. I do have a smart phrase button, so if I did previously create some smart phrases in here, I could go ahead and click them, and then they would come down here and be added to my note. Now, all of our templates are completely customizable, so you can customize a template simply by clicking between the question and the answer, double clicking here. It opens up that template question, and now you can change reword the question. You can change the type of answers or add to the answer list, and then you can also change the report sentence. As I go here, I have a review of systems. Now, the review systems can be completed by your staff, or it can be completed by a patient on the patient form. So right here we have patient forms. Patient forms can be completed on a tablet in your office, or you can have the patient complete them at home on the patient portal. But the patient form does allow them to put in their complaint, their past history information, and their review of systems. So they can go ahead and complete that review of systems section for you, and then you'll know what they're complaining about, because anything that they marked as a problem will turn red. So you can click on that section and you'll see that complaint in red. We do have physicals based on your specialty. So depending on what the patient is coming in for or what specialty you have, you may have one or a few different physical exams in here, and you're just going to complete those templates. Now, you could use this copy from past visit option. This allows you to look at a previous visit and see the note down here, and then check the sections you want to copy forward. So if you have a patient that's coming in for multiple times for the same thing, you may want to copy forward some of that information so you're not re-entering it multiple times. Under the procedure section here, or the specialty section, depending on your specialty, you may see all your procedure templates, questionnaires, assessments, things like that would be kept in here under this section. You will choose the option that you need. It will come over here. You'll be able to complete that template, and then you're going to have a separate note for that. So you'll have a separate output for that particular specialty, procedure, or assessment, questionnaire, whatever. You are able to access other things in the system from this area here. And then you also have your draw tool where you can select an image, and then you can mark that image and write what's going on with that, save it, and that can become part of your note. You have the order sheet, which allows you to place orders for labs, radiology, consults, procedures, prescriptions, and DME all from one screen. I chose to use radiology, and then I put in a radiology order here for an ankle x-ray, and then the diagnosis came over. I clicked create an order, and then my radiology order came up here. 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 And now I can review that order, put why it's medically necessary, go ahead and save it, and then I have the option to e-send it, print it, fax it, or preview it. If I'm doing prescriptions, I can either do my prescriptions from that same order sheet, or I can come to the prescription module and enter the information. I can enter the drug and the details of that drug, or I can go to the plus button here and I can go ahead and choose my drug from a preferred list. When I choose it from the preferred list, all the details come over the way I've set it up. And then I can just change them if I needed to change them. I can hit update. That moves the blue line to the next line, and I can go ahead and hit the plus button and choose my order again. I do have a save button at the bottom. Once I save it, I can go ahead and e-send it. I can cancel my e-send if I realize I need to make a change. And then also I have EPA, which is electronic prescription authorization. So I can do that as electronic as well. If you're doing a controlled substance, then when you hit the ERX button, it's going to give you a pop-up where you're going to get a message on your phone and you can click in the number and then it'll allow you to send. I'm going to the assessment screen now. Okay, when I go to my assessment screen, my ICD should come over from whatever complaints I've selected. And then also my CPTs will come over from the procedures that I've done or however I've coded it. Right here, I can give education to the patient. So when I click on the diagnosis, I have an education button that allows me to give out Medline Plus or Merck manual education. I can either put it on the portal, print it out, or email it to that patient. And then I can also write my assessment and plan from here. I also have an education button where I can give out my own education. So I can have my education that I like to give out from my office, add it to the system, and then I can choose it from here. I can put it on print it out, email it, or put it on the portal. Everything that I do will go onto the portal no matter what. And then when I'm finished with my encounter, I can click encounter, close, mark, and create my claim all at the same time. Then a copy of my progress note will show, and I can see my progress note. But everything that I do, a copy will go into the document list. So over here, I have the document list where I can see all my previous notes. I can view my notes here. If I want rather to view them at the bottom, I can move it over to the bottom. I can come over here, select a note, and then I can create a PDF, a zip file, print it out. I can also filter my document list or share my document list on the portal. So I have different portals that I can sign up for and share on the portal. And then I do have a filter where I can filter out my documents by provider, by case number, by document type, category, pregnancies, diagnosis code, date ranges, and also see what's been put on specific portals. And that's all there is to it. Thank you for watching and have a great day.